always thinking about having anxiety about the future or having anxiety about the past or worrying about both, and actually creating scenarios and thoughts that didn't exist yet as like a protective mechanism. And it wasn't protecting me at all. It was keeping me out of the present, so I was never present.
Nearly 100% of people live in either the past or the future. They do not live in the present, which is why you have such high rates of anxiety, depression.
And ketamine, it's proven to really change people's lives, so I gave it a try. It was like a mirror was put in front of me.
You have your true self, and then you have your avatar. We live in our avatar, and we think that that's the real inner self. When you actually transcend through something like ketamine therapy, you see yourself for who you actually are. Welcome to Balanced Conversations. Today we are going to be talking about mental health and the role that ketamine and other therapies play in your mental health.
So, is ketamine therapy a miracle or is it a Band-Aid?
Well, first of all,
what is ketamine therapy?
What is ketamine therapy and how is it different from ketamine use in a non-clinic setting?
So I'll talk about myself in a little bit, but ketamine is a dissociative anesthetic. So it's used to put people to sleep or help assist put people to sleep. We use it in my practice. And it's very, very, very effective, especially on the younger population, which we do a lot of sedation with the younger population. But regardless, it works on glutamate receptors, and it can regulate mood, and it can regulate kind of the neuroplasticity, and it can also, at larger doses, sedate you. So in a traditional psychotherapy setting, which would be with a medical doctor, you would go in and they would start an IV and they would introduce ketamine at the appropriate dose for an extended period of time. So you, instead of getting that full sedative effect where you're kind of like asleep and out of it, gone, you're getting this kind of steady state of neuroplasticity where you're able to change some memories, change some learning, change the way the brain is kind of functioning at that point. Because why are you going in to get ketamine therapy? You may have trauma, you may be depressive. And so it's an opportunity for the brain to kind of get away from that state of that trauma response and do some work. But the key is not just doing the IV therapy, it's doing therapies surrounding it. Because post the IV therapy, there will be a time period, again, where there's neuroplasticity and the brain can start to change, morph, and move away from that state of depression, anxiety, or trauma, and develop a new state. And so I'll speak about myself. I did ketamine therapy because I was going through some pretty difficult times where I felt pretty depressed. I mean, a lot of it was my situation, the people I was surrounded with, and I didn't like the way that I felt. So I looked for a non-traditional route to assist me with getting out of that state. And ketamine, there's a lot of research around it, and it's proven to really change people's lives. So I gave it a try. Now, I think it gets demonized, and that's a horrible thing that people are doing that, because it's just as powerful as any other drug that could, is prescriptive that we get over the counter. And it has been approved for these types of situations. So again, I went and saw the medical doctor. I went through these 6 sessions, and then I did psychotherapy with a counselor afterwards. And it absolutely, the way that I always describe it to people is it became, it was like a mirror was put in front of me. And I was able to see myself for truly who I was, who people around me, who they were. I was able to start to recognize that, I was in I had some serious trauma. So I had complex PTSD, which is, through trauma in my earlier life, I had developed some maladaptive behaviors and subsequently carried those throughout my life, which ultimately led me to the situation where I was surrounded by the people that I was surrounded by, because I made decisions to be around those people because of my inability to process things properly, to see the truth.
To your point of the ketamine essentially was a mirror that helped you see yourself for who you really were. I was just listening to something this morning actually about how you have your true self, your real self, your reality, and then you have your avatar. And one of the biggest problems in today's society is that we live in our avatar and we think that that's the real inner self. We think that that's actually us. So when you actually like transcend, which is the only way to actually know yourself through something like ketamine therapy, that's when then you see almost outside of your body, you see yourself for who you actually are. And it helps you learn who you are because you are not who the world thinks you are. You are not who your avatar is. And with social media today, we've created everyone's living in their avatar, quite literally. So everyone is putting their avatar out there and saying, this is who I am. That's not really who you are. Your avatar and who you really are not one and the same. So ketamine therapy helps you transcend so that you can see that you are not your avatar and then who you really are.
Yeah, no, I think that's actually a really good way of putting it because it then allowed me, because I always thought, okay, I need to be in social settings where there are lots of people, I'm well accepted, I have lots of friends, I have, I don't know, just kind of what everyone else around me was maybe doing. And the reality is, where do I find the most peace? When I eliminated all of those people, I eliminated all of those distractions, all of those things, and then really started doing some internal work about what do I want, what I want my legacy to be, what I really truly believe. And then that's what brought me closer to God. That's what brought me closer to good friends. And ultimately led me to Jessica, which I don't think I would have ever been able to find a partner in the state that which I was in. Mm-hmm. So there's a lot of beautiful things when you eliminate all those things that you think you're chasing or you want to have in your life. And the reality is they did not serve you at all. And it's not your true self.
And often your avatar's desires, wants, and needs are the kryptonite to your true self and who you really are. Mm-hmm. So what your avatar wants is actually often harmful to what you actually want. It's like a deflection. Rather than a reflection. Your avatar's a deflection to your true self. So you're deflecting, your avatar's deflecting, and almost like you're living in your ego self.
Yeah, so, in ketamine and being very, very, very safe to use. But I think that before and I did some
I had a question about the neuroplasticity thing.
Yeah.
Okay. With the neuroplasticity, you said that you did some psychotherapy post. So is there like a time frame, like you have to do the ketamine, then like right after? Like what is the time link that you have that neuroplasticity forming? And I guess we should tell everyone, so neuroplasticity is just the formation of new neural pathways, which is what helps you to learn, to form memories, all of that.
Mood, yeah. So I don't know that answer. I do think it's a short period of time, but it's enough that, for me, for example, I left and then that week I would do a counseling session and kind of work through some things and be given certain tools to help assist with regulating my mood and regulating the complex PTSD responses. And I think without ketamine, I wouldn't been able to really establish that, right? Because I feel like take the ketamine out of it, it's just kind of like someone's talking to you and that's it. Not that the brain's actually able to hear it and then create a new pathway.
Well, what I'm hearing from you is that it's very hard to unlearn something, right? But with ketamine therapy, you aren't unlearning something. You're creating space to learn something new that's more powerful than the traumatic tools that you were using before. Mm-hmm. So That's the difference in ketamine therapy. It's not, and something like ketamine therapy versus like SSRIs, right? So an SSRI, that's numbing you to the point of you're unlearning, but you aren't really unlearning. You're just numb and you don't care.
So flatlined.
You flatline, yeah. Whereas ketamine is actually it almost turning your brain into a baby again. It's like going back into that traumatic time and then giving you a do-over, essentially, a new way of thinking about it.
Yeah. I think it did assist too, which was a little bit further down the road. And I was a extreme hyper responder. So I responded extremely well to hypnosis. And I had always, as part of that complex PTSD responses, my brain played in the past and it played in the future. It never played in the present. So I was always thinking about having anxiety about the future or having anxiety about the past or worrying about both. And so, and actually creating scenarios and thoughts that didn't exist yet is like a protective mechanism. And it wasn't protecting me at all. It was keeping me out of the present. So I was never present. And stressing me and putting me in this state of fight or flight all the time so that I could never actually respond to things properly either. I was responding poorly to everything, even the simplest of things.
Well, 90%, no, probably more, nearly 100% of people live in either the past or the future. They do not live in the present, which is why you have such high rates of anxiety, depression, and that I have a toddler, so amygdala is very hyper right now, and that's the fear part of your brain, very useful when used properly. But that's why, when her green beans and her chicken nuggets touch, her response is incredibly over the top. And the reason for that is because all she has is that, I don't want this. And it almost is like a fear of anything that is not comfortable or that she wants to happening. But I heard a quote from someone once that said, imagination is best used in creativity. Imagination is poorly used in stress. So your imagination kind of is the be with all for everything. But if it's used poorly, then it shows up as stress, anxiety, depression. When it's used properly, it shows up as creativity. And so that's why, and when you are being creative, you are in the present, truly creative, not strategic, building something, but truly, or maybe building something, but not using, the logic part of your brain and strategy like that, but like tapping into the true creativity of your brain, then that's when you're actually in present you. Otherwise, you're living in a different time zone because consciousness has no time. There's no boundaries of time on consciousness. It's just here now, and it only will ever be right now in present time. There's no past, there's no future for consciousness. And humans live in our egos. Egos live in the future, and egos live in the past. Egos never live in the now. So if you're living in ego, you cannot be present. If you're living in consciousness and creativity, and you're living in, just the actual you, then you're living in the present. But it's very hard to get to living in the present and the who you are now in this world that we live in today, where everything is about your avatar. Nothing is actually about you. We used to live in a world where there were great thinkers, Socrates, Plato, all of those, right? But now, and it used to be part of our culture. Now it's not part of our culture to slow down. It's not part of our culture to be in the present, the actual real us, or even to ask ourselves, who are we? Because that would not be a smart money move. And it all comes back to that. They want us to keep moving, and never ask who we are, never go into our true purpose. We're basically like biological robots.
So the thing about hypnosis was that it shut off all of that noise. And I had this like spiritual experience with my father, because the same day that my dad died is the same day I went to hypnosis. And that's when the whole journey of like shutting off all that noise. And once that noise was shut off, that freed me. It was like I was in jail my entire life, literally behind bars, and restricted from actually experiencing life and being the person I needed to be until I entered into that phase.
Because of the anxiety, like the coming up with future scenarios that probably will never happen.
Yeah, the complex PTSD dialogue that goes on in the head or whatever. And so that got shut off. And what a gift that was. That's actually when I really started to become who I am now, who I love. Like, I didn't love who I was. I love who I am now. Like, absolutely. And so, it was because of this psychotherapy, the ketamine, the hypnosis. Those were all really big players in that momentum to move me in the right direction. So, to kind of counter this is a lot of people will just go in and they'll get antidepressants, which work on, serotonin, dopamine, norepinephrine. And the research has shown, and I don't know, we could probably put some research out here that we can find, because I know there's some great data that show that it doesn't effectively change people's depression. It really, really doesn't. It does have its place in acute phases or whatever, for sure. It's probably saving people's lives, and those medications have a function, for sure. I'm not saying they don't. I'm saying for the majority of people, there's so many other things that we could focus on and do to fix their depression. And I'm not saying the answer is ketamine and hypnosis and counseling. Yes, those are all great tools. Maybe it's really, do you have a hormone deficiency? Do you have a nutrient deficiency? Do you have sleep disturbances? Do you have other dysfunctions in your body? Do you have gut dysbiosis? Are you having just a toxic burden in your body that's overwhelming you? Like, even, I'm in dental, so we're drilling out amalgams. Mm-hmm. There's mercury in them. Mercury is a horrible toxin and neurotoxin. And so I had high levels of that at some point. I eliminated it through chelators, but what's your workplace? What's your workplace like? Is there mold in your building? Is there mold where you live? We really have to get back to the root cause. And once we address those root causes, I think the downstream effect is that depression that you're experiencing may diminish.
Yeah, I agree. And I think also, in order to, going back to the who are you really? If you are living in your body constantly and stuck inside of your body because it's constantly triggering, signaling something's not right, inflammation, fatigue, brain fog, whatever, you always feel off, not good, then your mind is focusing on your body and how you feel, because you don't have space and room to focus on who you really are, your purpose, and definitely no ability to transcend, because it's your ego realizing what's not going on with your body. And again, ego is living in the past or the future, never in the now. And so you cannot even begin the transcendence and the connection with your true self if you are super worried about everything going on in your avatar, in your body, because it is constantly failing you.
Yeah, I mean, there are other things too that you can do for your nervous system. What other things do you do, or do you know that people do, or that we do, that you can incorporate into your daily life to help regulate your nervous system?
The number one thing what I do to regulate my nervous system, aside from the wellness modalities here at Balanced, and
Is a couple glasses of wine.
Aside from peptides, that helps, yes. But no, I've started implementing this. So I'm a busy working mom. I have a toddler. We don't have any family around, so there's no support. So my cortisol is always on, and I'm always go, 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 thinking about what someone else needs, solving a team member's problem, always on, right? So I realized that what I needed most was a moment for myself. So my daughter wakes up at 7:30 in the morning. Every morning now, I wake up at 5:25. There's science behind why setting your alarm to 5:25 and 5:30 makes it easier to get up at the 5:25, but we won't go into that now. But you guys can look it up. It's interesting. So I wake up at 5:25 every day now. That means I have 2 hours to do what I want, me time, quiet. And so what I do at 5:25 is I get my coffee, I write. I journal, I reflect, and then I'm also working on a book too. So I write in that. But I've realized that that has helped me so much to be in a good mental state of mind going into the day, because I'm not waking up and immediately going into chaos and high cortisol level. I'm waking up, I have 2 hours to myself. I've started now to, right when the sun's about to come up, I go on the back porch and I just stand on the back porch and take several deep breaths and let the brand new sun actually hit my skin, because I'm inside 24/7. And just that alone has changed everything. It changes the trajectory of my day fully.
Yeah.
Did that answer your question?
Yeah.
What was your question?
Yeah, no. What techniques do you do, we do, that other people are doing to help regulate the central nervous system? And, breath work is one that's really, really good. Box breathing, I do that pretty often. I've also used neurofeedback through the Muse, the little headband that you use, and it gives you feedback on brain waves, and it gave me the tool, or it gave me feedback to learn, okay, what do I need to do? How do I need to breathe? How do I need to think? How do I need to center myself to lower that
What
brain
is
activity? It's called a Muse, and a little headband that goes around your head and gives you feedback. It's done through an app.
What do you mean? Wait, I want to do that. Wait, so what is the benefit of it?
So it's basically giving you data about your brainwave activity. I don't know the super details, but enough for you to then figure out, okay, what do I need to do? Is there certain noises that I need to listen to? Is there a certain way I need to think, center myself, close my eyes? Just basically put you into a meditative state. So kind of changing the brain waves to a more relaxed state. So it's giving you that feedback.
Oh,
it's
I
actually
love
kind
that.
of cool. So you learn truly how to meditate, because most people don't know how to meditate. They're like, oh, meditator is just sit still here, and like still my brain's
They
kind of like
can't turn
going
their brain
active.
off.
And so it's telling you, oh, your brain's still active. Let's try to adjust some things that you're doing, or even your thought process, breath, so that you can change that state. And so
know
it's
what
giving you
I've-
feedback.
You know what I've realized about you is that, so security is what most people want, right? Just security, right? So you feel most secure and comfortable when you have a ton of data. It's why you do all of the testing. It's why you trial and error with all these different wellness tech. It's why you do all of that, right? Because you want as much data as possible so that you can have as much information as possible so that you can try to prevent anything from happening in the future, right?
Yeah.
And I am the opposite. So I disassociate, which is not great. But the 2 hours in the morning where I'm writing, I'm very associated with myself.
No, that's actually
But-
a really good technique is journaling.
Yeah, and like creative writing too. Like that's
Yeah.
the best. But if I have a ton of data, like you always are on me, or you always tell me, you're like, get your blood work done. You absolutely need to get your blood work done, especially, with my being a partner in a wellness clinic. But I do get it done, but not to the extent that you do, because too much information, too much data gives me anxiety, because it's too much, and I'm like, I don't need there's way too much, and I don't even know like how to solve all of these problems all at once, or where to even start. Or I think I can just mind over matter it, and I'm actually very good at mind over mattering a lot of things. Your thoughts have energy, but you you like all the data, I like no data, and then I'm just gonna strong will it and mind over matter it, and nope, I'm gonna handle it, and I'm gonna
Isn't that a
make this
tattoo that
happen.
you have?
Yeah, down my spine. My granddaddy used to make me raise my arms when I was little, and he's the one who taught me how to have a strong mind. Honestly, everything's because of him. But I would raise my arms up, and he would tickle me, and then he would say, "Mind over matter, baby doll. Minds over matter." And he said, "Learn to control your mind, your thoughts, and you can rule the world, baby doll. Your mind is the strongest weapon that you have." And it has gotten me to where I am now in life simply because I I don't need a bunch of data and all of information. I can simply control how I feel in certain situations, or not manifest, but kind of manifest what I want, because I truly believe in my mind. Like, I'm confident that my mind is strong.
Yeah,
I know
no.
that sounds like woo woo, and I don't mean it to.
I don't think it's woo woo. I think there has a place. Now, some other things that I do is, and I just ordered it. I didn't tell you this. I just got this new device for Christmas. Jess got it for me. It's called a Violite, and it is a TDCS, so a transcranial direct current stimulator. And so
I used to do this. I went to a psychiatrist and did this once a week.
yeah, so it's a low level electrical current to the head that modulates nerve activity, and can either put it kind of in an excitatory state or a more relaxed state, meditative state, which I think is super cool that we have technology like this. And then also, as part of it, I have one that goes and stimulates the vagus nerve, which the vagus nerve is part, it regulates the central nervous system or parasympathetic nervous system. So when you activate it, they have all these devices now. You can Pulsetto is one of them. There's another one that I think it's called Hulist, where you just put it up against the vagus nerve. But anyways, mine just kind of sits on my neck here with that device and can put me in a super relaxed state, kind of take me out of that excitatory state, because we're always working, we're always on our phone, you and I are just constantly getting bombarded. How many emails do you get in 2 hours, right? Like 100.
Yeah,
Yeah.
100.
So that's stressful, and to take yourself out of that, lower that stress level, because we know what stress does downstream. I mean, even my mom's oncologist, when she got breast cancer, she's like, "Why did I get this? I don't drink, I don't smoke, I don't have any family history." He's like, "Stress."
Yeah.
And my mom was stressed all the time, but she also wasn't able to deal with it properly. And so, I want to avoid going down that path of disease state. So I'm using all this tech, getting all this information to try to make the proper adjustments. Now, could it maybe stress me out? I don't think it stresses me out. I think it makes me feel really, really good.
No, you're not. You have a different mindset than me. So you are just a different personality. You want all of the information you can possibly get. It doesn't stress you out, I don't think. But I do think that certain people do need to be careful with that, because you also have a very high intellect level in IQ, so you're able to organize that information more easily than some people maybe. Whereas if you didn't have the skill set or the knowledge to organize all of that information that all of the wellness tech and lab results and data is giving you, then that can make you feel like you're just dying or that you're super overwhelmed and you have no idea what to even do with it. So I think that yeah.
And to your point, you do something really, really special I should do more of. I wake up so early, I'm not able to see sunlight, and I'm in a building all day, but sun exposure. Like getting sunlight, putting your feet on the ground. And then also one other huge component, which we've talked about in other podcasts, is move your body. I mean, that's the biggest thing. If I'm not moving for a little while, lifting weights, doing cardiovascular activity, I start to feel off, like a little bit more, not depressed, but off, not centered.
Yeah.
And so moving your body is extremely important for mental health.
And moving your body, and because I will say this, so I always use the excuse, like, I'm too busy, all of that, right? But I'm never not moving. So except when I'm driving in the car, I'm picking her up. She wants to do this. It could be a hug, making food, washing clothes, playing princess with her. Like when I'm home, I am never not moving. I am moving until I sit down on the couch to do like the last 30 minutes of her bedtime routine with her. aside from that, I am up, moving, picking things up, going. When I'm at the office, I'm sitting. And I have to remind myself sometimes, okay, get up and move, because I'll be sitting for so long and I'm like, whoa, it's like I like forget I'm like in a body and I'm like, I need to move. I need to like, go somewhere. It's just like I'm like get stuck like a robot. But to your point, what I was doing outside. So it's not just going outside for the sun. So I go outside with the sun, but I do breath work then, because I think I only breathe that 2 minutes in the morning when I'm outside, when the sun first comes, like truly breathe though. Obviously I'm alive, so I'm breathing, but I am terrible at like consciously like breathing and resetting, and breath work is what resets your mind, your stress level, all of that. And I don't do it at all except in the morning, and it's changed everything. I'm much less reactive with my daughter, have much more patience with her. I don't forget things as much in the morning. So her bag, her change of clothes, her snacks, I need to do this. I'm not as forgetful. When I woke up and it was just bam, straight into get changed, get dressed, let's do this, let's hair, all of that, and then get me dressed too. It's like I wake up and go straight into chaos. And that, I didn't realize how much that was affecting my mental health and my overall well-being.
Yeah. No, I think those are all good things that you've implemented. Everyone should do that.
Yes.
So that's it for our podcast today. If you have any comments or questions, please put that in the comments below, and like and subscribe. See you next time.
Have a balanced day.